All right, setting up my screen share here. So hopefully this works. We're going to be going through my group's presentation. So appreciate, the patience and everything. So I'll be covering blunt force trauma in motor vehicle crashes. We're also going to be going over other blunt force trauma, including falls, and some of the conditions that can develop from both penetrating and blunt force injuries. So I'm just going to dive right in here. Open up with a there we go. Well, video. Unfortunately, I'm not getting the sound to work here, so you can imagine. So, good example of distracted driving. Poor kid. Luckily, he's okay. All right, so motor vehicles are the most common mechanism of injury related to blunt force trauma. So he's going to cover some facts here. Nearly 6 million car crashes occur in the U.S. each year. More than 90 million people die each. More than 90 people die each day from MVCs. 3 million people each year are injured. 2 million people suffer permanent injuries each year. 1 in 7 people do not wear a seatbelt while driving, which is not good because seatbelts do reduce the death by 45%. So they almost cut your chances of dying in a accident by half. So going a couple more facts here. So in car accidents or MVCs that we do see 6% fatality rate, 27% non-fatal injury, 72% causes property damage to the environment, surrounding objects, houses. Typical causes of accidents that result in death is going to be alcohol, speeding, as well as distracted driving. So this is a great thing to keep in mind because people are always doing more things than they need to when driving. 9 people die each day due to motor vehicle accidents caused by distracted driving. So 23 is how many times more likely you are to crash while texting and driving. 4.6 seconds, that's how many seconds your attention is off of driving when reading or sending a message. And 100, that's the amount of yards you travel in 4.6 seconds while driving 55 miles an hour, which here in Colorado, you're on I-25, where we know a lot of times we're going well and above 55. So I did see this myself some years ago. There was a documentary based on I think it's the movement or just kind of like foundation called It Can Wait, which just goes towards saying, it can wait, your message, your phone call, pull over safely, find a spot if you need to send that message. Otherwise, it can wait. So I love you. I love you was the message that Chandler Gerber sent to his wife moments before he crashed into a horse-drawn buggy. And unfortunately, due to that, he killed a teenager, he killed 2 children, and he injured 4 others. So he almost wiped out an entire family just to send 3 words to his wife that obviously could have waited until later. So we're going to dive into some of the types of motor vehicle crashes. When you do have a crash, it's going to consist of 3 different collisions. So there's a lot that we're going to be taking into consideration here. So each crash consists of a car against another car, tree or object, whatever is striking. That's going to be that first collision. That's not going to be causing necessarily the actual injuries, but the energy from that causing the second collision. So occupants against the inside of the car. Obviously, a lot of hard structures in the car, the steering wheel, items flying around the car, even people. If you're not wearing your seatbelt, that person essentially becomes a ballistic object inside of the vehicle that can also cause damage. And then the third collision, which is where we see all the bad things happen, occupant internal organs against the inside of the body. That's going to be that third collision. So a couple different types of collision that we see. Frontal head-on is going to be, you are going to see that airbags deploy. It does not take a lot of energy for those airbags to deploy, but that does give you a good idea of what to look for when you're, arriving on scene. Expect injuries to extremities from second collision and internal organs from the third collision. So lateral, or otherwise known as a T-bone crash. Very, very, very common cause of death within MVCs. Suspecting the lateral whiplash, so your head whipping off to the side, which has been shown it can actually tear the aorta, and which, that's almost immediate death there. Lateral crash with intrusion can also cause, as a New York accent, cause injuries to the chest and abdomen, pelvic fractures, which we know can be super fatal as well, and lower extremities. You're not going to have a lot of things, between you and the object that's going to be, causing the damage. If you're hitting a head-on crash, you have an engine block, you have a lot of things and a lot of space, a big old crumple zone that is going to hopefully protect you. But lateral, you have, a couple of inches, that are going to be between you and the environment. Rear end, so that's going to be big acceleration type injuries, concussions, any kind of strike where your your brain's going to be hitting the inside of your skull. Rotational, so just basically a spinning accident, which we saw an example of that in the beginning with that guy singing. Spinning of the vehicle can lead to impact with other objects, whether that's a tree or a telephone pole, and rollover, which happens a lot with those, high center of gravity vehicles, SUVs, trucks, and everything. Injuries are going to depend on whether or not you were restrained, and ejection and partial ejection can cause an unprecedented amount of injuries, as you would imagine. So this is a video of a pretty horrific car crash that happened, I think, in Chicago, Illinois. But the pickup truck driver was a little bit older. He actually fell asleep at the wheel, blasted through a red light, and as you can see, hit a bunch of cars. He actually did kill 2 nuns in that accident. Other types of accidents, we're going to see car versus pedestrian and car versus bicycle. So versus pedestrian, the injuries are going to be often graphic and apparent, so you're going to have pretty major blunt injuries happening there. Maintain a high index of suspicion for unseen injuries, even if it's a low energy crash. A good example of this, I had a good friend, she's okay now. She got clipped, not even full on hit, but got clipped by a car. She lost her balance, and the third collision is what really caused everything. She smacked her head, and she wound up with intracranial pressure, and she had to get brain surgery. They had to cut her skull out and let the pressure come down to not cause brain damage. And she got hit by a car going, 5-6 miles an hour in a parking lot. Speed of the vehicle can tell a lot. High speed can result in additional collisions with the environment, hitting the windshield and flipping and flying all over the place. Low speed can result in being totally run over by the car. So if the car is not going fast enough to send you flying, it could fully just run over you and cause a lot of crushing injuries as well. And when you're arriving on the scene of a car versus pedestrian, the vehicle can tell a lot. The vehicle can give you good insight to how much energy was involved in that crash, if you're going to be suspecting internal bleeding or other injuries that you might not be able to see. Versus bicycle, maintain the similar suspicions as above. And then in this case, looking at the bicycle and the helmet is going to give you a lot of clues as to what things to look for. And always with both of these and with all of these considerations, always alert ALS, and suspect spinal injury unless proven otherwise. So here is, car versus bike. Car came blasting through I think there's a group of protesters. They're protesting for the environment, to spend more time on a bike than driving. And yeah, not good. Car versus motorcycle. So went on scene, inspect the deformity of the bike and the side with the most damage. So distance in the skid in the road, including the trail debris, deformity of stationary objects, other vehicles involved, and extent location extent or location, I should say, of deformities in the helmet. Hopefully the rider is wearing a helmet. And the helmets are meant to protect the head, not the spine. So always consider C-spine in these situations. And with the helmet, really should leave that helmet on unless it is obstructing the airway. If it's getting in you of way of giving them oxygen and adequate breathing, then leave that helmet on. Types of motorcycle crashes. So you can see a head-on crash of a motorcycle where the bike stops by hitting a stationary object, whether it's a parked car or tree or anything, and the rider continues their forward momentum until they are stopped by an outside force. Angular, the bike hits another vehicle or object at an angle, and that's going to be causing a lot of crushing injuries to the lower extremities, and potentially being pinned between the bike and the object. Ejection, this can happen quite commonly. Obviously, you're not very secured to a bike, you're not wearing a seatbelt, but rider traveling at high speeds is stopped by an object while they continue their forward momentum and sliding along the pavement, suspecting severe abrasions, also known as road rash, and those could be very severe, almost all the way down to the bone. So making sure you're taking care of those, preventing infection in those situations. And then controlled crash, which would be known as laying down the bike, or just a way to separate the rider from the bike and the object that they might collide with. All right, so moving on here to cardiac tamponade. This is when blood or other fluid fill the pericardial sac, which is going to be surrounding the heart, protecting the heart, and that compresses the heart. So obviously, with doing CPR, you're looking for compression, but also letting that heart fully expand and fill with blood. So this is going to lead to decreased cardiac output because the heart is unable to completely open up and refill during the relaxation phase. Inadequate blood flow causes a decrease in systemic blood flow, occurs most often in penetrating trauma, but can also be caused by blunt force trauma. You can kind of see what we're looking at here on the pictures on the left, and that fluid building up. Signs of cardiac tamponade. So we call the Beck's triad. So hypotension, muffled or distant heart sounds, and JVD. So, when you're getting your initial vital signs, if you do notice hypotension, and also depending on the call, the nature of the call, leading your suspicion potentially towards this. But once you go into that secondary assessment and you're inspecting the neck and the trachea, you're gonna be looking for midline trachea, also looking for JVD, and if you do get two of these three, get that stethoscope out and listen. If you're listening and you're hearing muffled or distant heart sounds, that's going to be that decreased diastolic filling. So these signs often subtle until the situation is very dire. We can see those extended or engorged jugular veins, narrowing pulse pressure. So, seeing the kind of merging of the systolic and diastolic. That's, once those numbers get closer and closer together, that's not good. 120 over 80, but is, a healthy heart or healthy blood pressure. But once you get hypotension, that systolic starts dropping below 90, and then you almost see a merging of those two numbers. That's when it's time to go. And treatment. So pre-hospital, there's really not much that we could do. Positive pressure ventilation for any patient who is hypoventilating, so not breathing enough, or apneic. This could also be done with a BVM and throttle therapy. Get them to the hospital. This is not going to be us. This is obviously in surgery, but what they're going to be doing at the hospital, which is going to be saving their lives, is pericardiocentesis. So just basically they're going to be going into the heart and draining that fluid with a needle, therefore allowing that heart to completely fill each and every time. So you can get this playing here. So this is going to be the surgical drainage and repair. So you can see an image right here. All that fluid in the heart. See, they crack them open. You see that pens, or the very, very tense pericardium here, and this is where they make that insertion. You see that almost immediate relief, that fluid coming out of there, and yeah, they're gonna be draining that thing. Oof. Not a good day. All right, so rib fractures, commonly caused by blunt force trauma, common injury to occur, especially in the older population, weaker bones, you're more susceptible to those rib fractures. And the really bad fallout from these rib fractures, they can lacerate a lung, causing a different type of pneumothorax, tension pneumothorax, hemothorax, or a hemopneumothorax, which we'll go into in a little bit. If the upper four ribs are fractured, then you can also suspect a systemic injury. Oops, sorry. So signs of rib fractures. So, as you're approaching the patient, a lot can be, told, and a lot can be understood from your, I guess your treatment before we even make contact with the patient. Whether or not you need to make, rapid transport. But looking at how are they breathing? Are they breathing with pain? Are they taking very short and shallow breaths? What is the reason of the call? Why are you being dispatched there? Was it assault? Was it a bad fall? You're going to notice them, kind of and not, taking in very deep breaths. So most common cause of non-fatal trauma is going to be falls. Each year, 250,000 or more are treated for falls in the ER. Elderly is more prone to a fatal injury once the fall has occurred. You do unfortunately see that happen. If they're falling, breaking their pelvis, or any of the musculoskeletal system that they need for just movement in general. Being immobile is not going to be good for that population. It can cause infections. You can see people, dying from, multiple other causes after the actual fall. Contact sports such as football, high school, college, NFL level are going to be having collisions that can produce the same amount of force as a vehicle accident, which is kind of wild. So here's a opening video. Obviously, another not a good day example. Bam. So that was a fall from quite a while. Obviously, he was jumping out of an airplane, and parachute didn't open all the way, and so lower injury or lower extremity, to the max. Looking for right there. And obviously, the greater the height of the fall, the more energy is going to be built up into that, greater potential for injury. A fall from more than 20 feet is considered a significant fall. And when you fall, your internal organs experience the same weightlessness as your body. Thus, when you make impact, they're going to be slamming against your, the hard structures of the inside of the body. You see this poor fella there in the Rio Games. He was going off the vault right behind him and fell. And unfortunately, it looks like he had a pretty nasty fracture of tib and fib, and maybe even the ankle. Not really sure. So just a quick little snippet, wham bam. Oof. So looks like a wrist, elbow to me. All right, so flail chest. So me going back here is just to some chest trauma. So so flail chest is going to be seen with some blunt force trauma. And what kind of what happens here, one of the things you're going to be noticing with flail chest, or flail chest to look for, I'll have a video for you at the end of this, is you're going to have like a flail segment. So it's basically where the chest wall kind of completely detaches, and that detached portion is going to be moving in the opposite of normal. So we call that paradoxical motion. So obviously on inhale, you want to see, equal chest rise and fall. You're going to notice, and quite asymmetry there. So when you're inhaling, looking for those lungs to expand, and you can see on the picture on B right here on inspiration, that flail segment is going the opposite of normal. So pre-hospital care, so some bulky dressings here to kind of prevent that bad movement from happening, and applying positive pressure ventilation with a BVM. So some of the implications here: pulmonary contusion, mediastinal flutter, pain, pneumothorax, hemothorax, and all of these combined can lead to respiratory failure, which obviously is not what we're looking for. So mediastinal flutter, that's going to be the movement of the tissues and organs of the mediastinum back and forth, and with all that movement of air into and out of an open sucking wound in the thoracic cavity. So obviously that condition is going to be causing a lot of impairment of the cardiopulmonary function, and can be fatal if not treated. So another one here, commotio cordis. So this could be like the sudden stop of cardiac activity. This is what you've probably seen, unfortunately, with some younger kids in sports. So baseball, lacrosse ball, something with like a small surface area, those smaller objects. Hockey's another one. A hockey puck. Obviously, the smaller the object, the more pressure you're going to be applying. Over the small force. Kind of thinking about someone laying down across an entire bed of nails is going to be a little more protective than sitting down on one nail. You're going to be seeing that pressure and obviously causing penetration. In this case, causing the cessation of heart activity. So basically, what this is that pressure, that impact happening during the upstroke of a T wave. You can kind of look there on the bottom. So not or during very 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 minute moment of that heartbeat. And unfortunately, with this, survival rate is not very high. 24% is going to survive from this. So almost a 75% fatality rate. There's not much care we could do. It's just, again, getting them treatment as soon as possible. And so let's go back. This is going to be a video of a flail segment here. So you notice on the left side there and the right side, not moving symmetrical, not seeing equal chest rise and fall. And I'm going to go finish up here going into so pneumothorax, which is going to occur or open pneumothorax rather, occurs when air accumulates between the chest wall and the lung. And the larger the opening, then the greater that pneumothorax. So this obviously leading to a collapsed lung. Tension pneumo, so occurs when air is trapped in the pleural cavity under pressure, displacing structures and compromising cardiopulmonary function. So basically see the air leaks outside of the lung into the pleural cavity, and the air is trapped between the pleura and the lung. And again, we're going to be seeing, some decreased respiratory function with this. So pneumothorax, simply known as a collapsed lung, shortness of breath, chest pain, And people that do have COPD, they're going to be a little bit higher risk for this. And in the field, as you know, PLS, as an EMT, not much that we can do other than providing the high flow oxygen. But what ALS could do, or once you're in surgery, is going to be a needle decompression, and basically just inserting a needle, pretty quite long, between the intercostal spaces, and going to basically have a little catheter on the end, and that's going to allow that air that's moving out, so you can actually hear it. It's quite apparent once you're in there. You can actually see some pretty amazing videos of these things happening in the field, and then obviously surgery. They can implant a more of a permanent structure, like a chest tube, that they can get all that extra air out of there. But yeah, thank you for letting us follow up with this presentation. Sorry it took a little bit long to get over to you. And yeah, let me know if this all works.